Well, in just his first week in office, President Trump has set about rolling back legislation passed by the Biden administration, including an executive order that would make more drugs available to Medicare patients for just $2. Joining us now with more, we've got Yahoo Finance's Jordan Weissman. Jordan, what do we know here, and how is this rule supposed to work?
Yeah, so this is a small but I think really telling story from the first week of the Trump administration. Essentially, he rolled back an executive order that Biden signed in 2022 that just told federal regulators to find more ways to reduce the prices of prescription drugs. They had already passed, as part of the Inflation Reduction Act, the big Medicare prescription drug price negotiation program. And this is to find other ways that they could make pharmaceuticals a little bit more affordable for seniors. One of the ideas that they came up with, that the regulators came up with, was this thing called a $2 drug list. You see companies like Walmart do this, where they say, hey, here are all the drugs we offer for $4 a pop, for $2 a pop. The idea was to have Medicare prescription drug plans do something similar. Say, here are all the generic prescriptions that are commonly used that you can get for $2. And the idea was, this was going to save seniors a little bit of money, possibly, maybe like $50 a year, but it would put a little bit of extra cash in their pockets, about $2 billion for everyone collectively. That program that was never implemented, but it looks like it's going to be scrapped as a result of this rescission of the executive order.
Now, Trump has said as recently as yesterday that he wants to lower costs for Americans. Why would he want to get rid of this rule?
There are some ideological differences between Democrats and Republicans when it comes to dealing with prescription drugs and how to manage Medicare. A lot of conservatives saw this program as kind of micromanaging the prescription drug program. And that's part of what's probably going on here. There's also just a desire to, I think, break with the prior administration. But people are wondering what this means about how Trump is going to handle those upcoming Medicare drug negotiations. This year, the Trump administration is going to be in charge of negotiating the price of 15 pharmaceuticals, including Ozempic, for Medicare. How is he going to handle them? Is he going to drive a hard bargain? Not clear. People are a little curious after rescinding this executive order on drug prices.
Jordan, thanks so much for tracking this and bringing us to the latest. Appreciate it.
Thanks for having me.